Hello everyone, it's Elizabeth, and this is going to be a discussion on hyperparathyroidism. And if you haven't done the one I've already done on hypoparathyroidism, you might want to just go back to that one because I do discuss the location of the parathyroids and their function a little bit at the beginning of that section. So let's dive into hyperparathyroidism here, and we will start, like always, here with our patho on our patient care concept map. All right, so the patho, we have increased secretion of hyperparathyroid hormone, which results in an increased calcium level. So for hyperparathyroidism, we have high parathyroid hormone, which causes high calcium level, okay? And then the parathyroid glands do not respond to the normal calcium feedback system. So as we kind of discussed in the thyroid section, one type of hormone is released, which then causes some other gland to produce some other thing. Well, in this case, it is parathyroid hormone and calcium, okay? So it is typically thought to be that, lovely word here, we have idiopathic. I don't know why this is happening. So primary hyperparathyroidism is typically thought to be idiopathic. There are some secondary causes that we know about, and the most common being a tumor on the parathyroid gland. So it's usually a benign tumor, but it causes excess secretion of parathyroid hormone, which then causes hyperparathyroidism. Also, chronic kidney disease is an issue that can kind of lead to this problem as well. So if we have hyperparathyroidism, we have increased secretion of parathyroid hormone. And this has an effect on the bones by causing an increase in bone destruction and a decrease in bone production, leading to fractures in our patients because their bone is now, having increased destruction on the inside there as it's making new bone. It's not making new bone like it's supposed to be, and it's destroying bone at an excessive rate. So when it's taking the calcium out of the bone, it is now putting that calcium into our bloodstream, which leads to the high level of calcium that we can measure in the serum calcium level. And it's also depositing some calcium into the soft tissues of our kidney, which causes us to have renal stones, okay? And the hyperparathyroid hormone increases, which leads to increased serum calcium levels and decreased serum phosphate levels. So the phosphate is low and the calcium is high. And we know that the increased calcium, as we've already discussed here, causes increased bone resorption and decreased osteoblastic activity, which is bone production, which is something that's always going on in the body, okay? But it just kind of really messes with that regulation and causes us to have less bone production and more bone destruction, which then leads to a decreased bone density and an increase in serum calcium levels. And the chronic calcium excess that's kind of floating around leads to the calcium being deposited into our soft tissues in our kidney. And mostly whenever we talk about the parathyroid, any symptoms that we're going to get are really going to be related to the level of calcium we have. So in this case, we're talking about hyperparathyroidism, which is going to give us the symptoms of hypercalcemia. Okay, and we remember this. We have this cute little saying of bones, stones, abdominal groans, and psychiatric overtones. So bones is this high risk for fracture. Stones is increased incidence of renal stones, which is, the kidney stones that basically feel like a bus coming out of us, but they're really teeny tiny little, measured in millimeters, not even usually centimeters, so tenths of centimeters. And then abdominal groans, so we have constipation, which if you think about, if we take a calcium supplement, it can lead to constipation. So it's going to make sense that if we have increased levels of serum calcium, that we're going to have a symptom of constipation. And then indigestion, nausea, and vomiting. And then psychiatric overtones, confusion, lethargy, and fatigue. That is our bones, stones, abdominal groans, and psychiatric overtones. Now we'll go up here to assessment, A for assessment, P, A for assessment. And all of this is just exactly what we just discussed, the symptoms of hypercalcemia. Bone fractures, weight loss, psychological stress, renal stones, osteoporosis because of our decreased bone density that occurs, nausea, vomiting, and constipation. And then peptic ulcer disease, which is, ulcers, gastric ulcers. I'm sure you've heard of those. Psychosis and confusion. So bones, stones, abdominal groans, and psychiatric overtones, the symptoms of hypercalcemia. Now we will move over here to T for tests. We are going to check a BMP, which is a common test that we do patients to just check the electrolyte levels. So the BMP is going to give us that calcium level, and that's the main thing we're looking for in hyperparathyroidism. And then the phosphorus level, we do have to order that separately. That doesn't come on our BMP, but we're looking for that to be low because it's kind of the opposite of whatever the calcium is in the hyperparathyroidism. And it's high, so it's going to be low. And then a DEXA scan, which measures bone density, all right? And so if our bones are getting all the calcium sucked out, then our bone density is going to not be very good. So we can do this DEXA scan to kind of test our bone density. And then we may want to do an x-ray to evaluate for kidney stones. So patients who have hyperparathyroidism are going to have calcium. All the excess calcium may go into the soft tissues of the kidney and cause kidney stones. Kidney stones are obviously extremely painful, but sometimes you can have kidney stones that are just sitting within the kidney and they're not actually causing symptoms. So we may want to just go ahead and do an x-ray and see if they have kidney stones, even if they're not having symptoms. And then the parathyroid scan, that may need to be completed to check for a parathyroid tumor, which, as we discussed, could be a secondary cause of hyperparathyroidism. All right, interventions. So one of the biggest things we're going to do here is to try to prevent injury. Because our patients have really brittle but want to have some minor incident occur that causes a major fracture and kind of ongoing issues for the patient. So that's a big one. And then we're also going to give our patient furosemide, which you may have heard that one called Lasix or maybe referred to by the public as a water pill, but it is a diuretic. That's its medication class. And it causes increased secretion of calcium in the urine. So while we're doing all that extra peeing while we're taking our furosemide, it's helping us to get rid of some excess calcium. The patient may get IV normal saline, and they may get cinacalcet, which is an oral medication that binds to calcium to kind of help them secrete that. We do need to keep an eye on their EKG or their cardiac functioning because the heart has a lot of nerves that help it function, and calcium really regulates nerves. And then we're going to monitor the serum calcium levels, so we're going to double check it and make sure that it's going down, but we do want to report rapid drops to the primary care provider because we really don't want it to drop too quickly. And then we're going to strain the urine. So there's just a little white strainer that comes that you can give your patient, and the patient would actually pee in like a hat, and they pee in the hat, and then they can dump the urine from the hat into the little strainer that they get, and this would catch any renal stones that they would pass. And then another intervention that they may get would be a parathyroidectomy, which if you listen to the discussion on hyperthyroidism and a thyroidectomy and what a serious intervention that is, it is similar to the parathyroidectomy, very, very significant surgery that requires a lot of close nursing care. And then we just have to remember that it may take days to weeks for the remaining parathyroid gland to return to normal function. So that is just something to keep in mind. And E for extreme, worst case scenario, severely elevated calcium levels may lead to psychosis, which the patient could injure themselves or others, and then death. We don't want anybody to die, so we need to make sure that we get this taken care of. And our nursing diagnoses under N here is risk for injury, and then acute pain secondary to skeletal dysfunction or renal colic. And so if you don't know what renal colic is, it's just as the stone, the kidney stone, is passing through the ureter, the ureter actually has like peristalsis kind of action, kind of like the intestine. So it kind of moves urine through the ureter. Well, if there's a stone in there, it's causing pain as it's moving, and then when it stops moving, it's not really as painful. Then it starts moving again, and it's really painful. So that is what renal colic is, in case you had not heard of that. Okay, so what can we teach our patient with hyperparathyroidism? We can teach them to avoid foods that are high in calcium and vitamin D. And we can encourage regular weight-bearing exercise to support bone health. So if we're exercising, that does help our bones. So that would be something to recommend. We don't want them to do anything strenuous or that might, of course, cause them an injury. But regular, just normal weight-bearing exercise. And then increase fluid intake to discourage renal stone development. And in the same token, avoid dehydration, so that way we're not having, a worse situation as far as renal stones developing. So that is basically everything about hyperparathyroidism. And just keep in mind, I know it can be a little bit overwhelming with the hyper and the hypo on the thyroid and the hyper and the hypo on the parathyroid. But the parathyroid specifically, everything we're talking about here is mostly related to calcium levels. So the symptoms and the interventions that we're going to do is based on either a high calcium for hyperparathyroidism or a low calcium for hypoparathyroidism. So I hope that helps, and if you have questions, just let me know. Thank you.